This is Dr. Dan Adair, Springfield Clinic Orthopedics. I'm going to talk a few minutes about articular cartilage and articular cartilage repair. That's a kind of a neat subject, which is you will hear some things on the news about. And basically, the articular cartilage, and I have a little model here to help me out. The articular cartilage is the white pearly stuff on the end of the bone. So that when you look at a chicken bone, that white pearly stuff that covers the end of the bone is what actually slips and slides and allows us to move fairly effortlessly with a fairly friction-free joint. When this begins to wear, and it does begin to wear frictionally, but also biologically. Biologically, your articular cartilage gets gray hair, it gets wrinkles, it doesn't function or work as well, just like everything else tends to as we age. What we're trying to do biologically is to be able to biologically make cartilage which will replace our normal cartilage when that wears out. Unfortunately, presently, we don't have a very good solution for diffuse or degenerative arthritis throughout the knee. So if your knee is full of arthritis and is bone on bone in multiple areas, we probably don't have a very good biologic solution, and a total joint is probably more appropriate. However, if you have a relatively isolated defect, and this is just a little model which will show you this is what an isolated defect could look like, where there's basically just one spot, typically penny size, quarter size, that doesn't have articular cartilage on. We're beginning to be able to have some things to be able to replace that. Among them are one which is a tried and true, which is called a microfracture, where then we'll poke some holes in here, and then biologically the body will replace that with a type of scar tissue. The other types of changes we can do is we can take some plugs and kind of take them from where they're needed less to where they're needed more, or where they're more important. The other thing we do is called the ACI, or autologous cartilage implantation, which was developed over in Sweden about 10 years ago, where we take some of your cartilage cells, send them to the lab de-differentiates them back to primitive cells and multiplies them, and then differentiates them back into cartilage cells again. So they send us more cartilage cells, but they're yours, and then put them in a hole like this and put a little patch over it. That works okay, probably a little better than the microfracture, but not dramatically. Now lately there have been some new things, and new does not always mean it's better, it's just new. One of the things we've been working on is the use of baby human cells, an allograft, or a tissue from another individual, and putting them in this defect. The reason these work well is because baby cartilage cells are still metabolically active and are still changing and growing and producing very good articular cartilage. Once our cartilage cells get past age 13 or 15, they no longer divide, and the products begin to deteriorate what they're making. So this is just what it looks like when we do what's called the de novo procedure. We take these little hunks of articular cartilage, make a little crater, put them in there, and then basically glue them in there with this sort of super glue. And what those cells do, they're pretty happy with there, and they will go ahead and multiply and divide in there and create new articular cartilage. So that's kind of one of the future things we're looking at. And a couple other ones which are not FDA approved yet are using a matrix that we could implant, which is used over in Europe, but is presently not able to be done in America. But this continues to be a challenging field, and there is no great answer for replacing articular cartilage in humans, and we're at best trying to just patch the pothole in the road.